Hi there and welcome to the Ask Dr. Jack show. I am Dr. Jack Belitz, chiropractor in Omaha, Nebraska, and I am here to answer the questions that you ask. I had a patient come in earlier this week and ask about acid reflux. They were having issues with that. They went to their primary care doctor and he wanted to put them on a drug called a protein inhibitor. They said that it would cut down the amount of stomach acid that was being produced and thus would eliminate the acid reflux. And my patient was scratching their head saying, well, if I get rid of the stomach acid, won't that cause me other problems? So they came in to ask me if I had any suggestions or information on this. And again, this is not here to give advice whatsoever on any drug. I am here merely to give you information that you can use to decide what is best for you. So, found a study that looked at 10,620 men and women with the actual term for the reflux is GERD. It's gastroesophageal reflux disease. And it describes a situation in which the stomach acid refluxes into the esophagus and can cause things like heartburn, constant coughing, hoarseness, pneumonia, and even potentially esophageal cancer. So, what they found in this group of 10,620 people is that the people taking these drugs were 50% more likely to have osteoporosis than those not taking the drugs. Now that's not a small number. That's huge number of people that are being exposed to osteoporosis. So the question is, why that? Well, think about this. If your body is not producing stomach acid the way it should, then your food isn't being broken down. If your food isn't being broken down, then all the nutrients that you're eating in your food are not available to your body to be able to use to make yourself healthy and keep your functions going. Another thing that stomach acid does is it keeps your body from allowing bacterial growth from the foods and things that we're eating. So one of the other problems that people with these PPI drugs or these stomach acid drugs are having is they're leading to infections of the intestinal tract, diarrhea, colitis, C. differentiale infection, or candida infections. Now, if there was a herb or some type of vitamin that was causing these things, all heck would break loose in the FDA and that thing would be shut down. However, we're talking about the big pharmacy company and they've got the ability to say, hey, no big deal, right? And they get the studies they need and it goes right past the FDA. So there's another study that found that it is potential that at least 60% of the people that are on these type of drugs don't really need to be on them. Now, this is just my opinion. Take that for what it's worth. But I think that the number would even be greater than that. We look at what's causing acid reflux, and very often we find that people that are suffering from this problem also have a hiatal hernia, and that's where a part of the stomach has herniated through the diaphragm and is sitting up inside the diaphragm. And so when the cells that are lining that part of the stomach are producing their acid, very often they reflux right into the esophagus because they can't go down because that diaphragm's squeezing on it so hard. So if we can eliminate the hiatal hernia, which there is ways to do that without surgery, then very often we notice that the problems with the acid reflux go away. There are a lot of other things that can be done with this particular problem. So if you have any questions at all and you would like some more information, call the office at 402-333-4848, and let's see if we can give you some help with this that doesn't require this particular type of drug, because there's just a lot of good reasons to try to avoid it if it's possible for you to do so. Okay, that's it for this edition of the Ask Dr. Jack show. I am Dr. Jack Belitz, your host. If you have a question that you would like asked, call the office up, 402-333-4848, or walk into the office, or if you want, you can email us at askdrjackbee@gmail.com. That's askdrjackb@gmail.com. All right, have a very happy and healthy day, and I'll see you in the next episode.